Pregnancy is a state of health. It's not a state of illness. Upright positions are the best positions. Those are gravity neutral. When the baby is taken out and immediately placed on the mother's chest, the baby goes silent. It's hearing the same heartbeats that it was hearing inside the womb. With medical intervention, you buy one, you get one free. The more you're going to get up and move and you're going to change positions, this baby is also going to descend. Something which women fail to understand. They'll be just flat lying on their backs and they refrain to move because they're scared.
Our mistake was not preparing for childbirth, just trusting that the doctors and the nurses will do right by us, but it is so far from that. Hello and welcome to another episode of the Modern Indian Parent Podcast, the podcast that is redefining parenting in Indian families. I am Rinie Gupta and I'm a pediatric sleep consultant. And we release new episodes every Friday on YouTube, Spotify, and Apple Podcasts. So subscribe or follow our channels for the latest updates. Today's episode is about how we can empower ourselves during pregnancy to have the best possible childbirth, because it is truly one of the greatest days of your life. Our guest today is Mekha Shaji. She's the founder of Inizio Birth based in Mumbai, India. She is a certified Lamaze instructor and a birth doula. She will teach us exactly what the Lamaze philosophy is that will help you have an empowered childbirth. So if you're expecting the baby, do watch this episode till the end, or share this episode with somebody in your circle who is expecting one. So without further ado, let's welcome Mekha to get this episode started. Hello and welcome, Mekha. Welcome to the Modern Indian Parent Podcast. How are you doing today?
Lovely. I'm so excited to be a part of this podcast. I think we've been planning this for ages.
Absolutely. And I think for our audience, we should know one of the reasons that it wasn't really working out, because you have some good news to share. Mekha is actually expecting.
Yes, I think the world knows by now. So yeah, I'm so glad that, I got this opportunity to talk about the subject that I love the most.
Yeah.
And, finally I'm able to do that at the time when I myself am experiencing this and I'm going through this journey.
Absolutely. That is so, so beautiful. But tell me something, Mekha. This is your first baby, right?
Yes.
How did you think that you want to be a Lamaze instructor and a birth doula, even without having any children of your own?
So I am a nurse. So I have done my nursing. So back in my days, when I used to be going through my clinical practices, we used to be in the field for long hours, like in the hospital, attending births, delivering babies. And what I saw there was horrific. I remember when we used to come back for our lunch breaks, we used to have discussion with our friends that I would never want to give birth if this is how it is to, happening. And why that was so, we would just see them crying, shouting. I could see their eyes looking for some ray of hope or someone who could actually tell them what they could be doing right to actually make them themselves comfortable at that time. But unfortunately, no one had the time to do that over there. And later on, when I started working in a hospital, I actually came across a very, very beautiful birth story from my cousin. And that was the first time that I came across this word called Lamaze. And me, as a 21-year-old or 22-year-old at that time, I really did not even understand what is this Lamaze. This is something that I have seen in movies. But what she has written, her birth story was like she was given a safe space. Her midwife allowed her to walk around, move around. Her partner was there, and she was allowed to just be at home for as long as she wanted. And that's when I was like, if I ever have a birth, I want it to be like this. And my curiosity sparked more and I started doing more research, and that's when I found out if women actually want to know or take charge about their births, it should start from right childbirth education, because we were meant to do this. But just that we just need to be guided well. We just need to have the right people around us. I understood somewhere a childbirth educator is going to play a very big role in the field of birth. And there are not many people who are doing this. And someone has to start doing this. And that's when I stepped in. I did my Lama certification. And slowly, when my clients started asking me, could you actually also help us during labor? And that's when I started working as a labor support for them.
Wow, what a story. You know, when you were describing the maternity ward, women are
Yeah.
laying on their back, they're shouting, it's just so much pain, they don't know what to do other than probably just wait for drugs. And this is so similar to what I went through. And my birth story was not something that gives me a lot of happiness. To be very candid, I've never shared my birth story on any platform before, even though I've been on social media for a long time. It's very hot popular to share your birth stories, but I never did that because I wasn't particularly proud of it, you know? And just to give the listeners a bit of a background, when I was pregnant, by the third trimester, I realized that I have a condition called obstetric cholestasis. So this is a genetic condition. And when I realized that I have this, my doctor told me that to avoid the risk of a stillbirth, we have to induce you by the end of your 37th week. For me, I just trusted my doctor blindly. I said, sure, you do what you need to do, you know best. And I put my entire trust in her that she will be there to guide me through the whole birth process. Turns out, when I reached the hospital, I didn't see my doctor for an entire day. I was left to the nurses, everything from the induction process, then waiting in the room for the labor to kick in. Everything was a very isolating journey because I wasn't given adequate information. Why? Because the doctor appointments are so short, you're in and out within 5 minutes. Sometimes even lesser, especially if things are looking normal, and nobody thinks to preempt you or educate you about what's to come next. And then for me, once the induction happened, the labor only started 9 hours later. I was getting restless almost at why is the labor not starting? And then the labor started. But because this was a big medical intervention, the very moment I started feeling pain, labor pains, I started having contractions every 30 seconds to 1 minute. And they were so intense. And my nurse was there, oh, you're having contractions? Oh, okay, cool. That's it. So the next thing I thought was, are you going to give me any medication to manage this? Now, they told me that the medication that we can give you depends on your level of dilation, because I knew I wasn't wanted to get an epidural because, you know, people around me told me that epidural is good for you. It makes things easier. It really is. But what they didn't tell me is that you need to reach a 3 or 4 cm dilation before they can administer epidural. Turns out it took me 13 hours to get there. It was 13 hours of having contractions every minute to get there. And in the meanwhile, the pain management they could give me was they gave me laughing gas. So there was a mask available in the delivery room, but that made me feel so dizzy and disoriented. It almost felt like drinking a bottle of tequila. No kidding. You feel so dizzy. You're just like, oh my God, like what's happening? And then I think that does momentarily take your focus away from the pain. But you don't have control over your body. And I think, and that's a very bad thing, because when the doctors came in and they kept on coming in for like cervical examinations and everything, I was so restless and so disoriented. I kid you not, I kicked one of the nurses.
It is a very tricky method, and that's why it's not widely recommended as well.
Exactly. But I think it's in the hospital that I gave birth in. This is a very standard pain medication management. And I think when I got to sort of like a 1 or 2 cm dilation, they gave me a pethidine injection in my thigh until I was dilated enough to get to the mark where I, could get an epidural. Now, here's the fun surprise. I didn't know that an epidural is an injection to the spine.
Okay.
When the anesthesiologist came in, I was like, hey, so I've got all these tubes hooked up here.
So you can just
put
inject
something
me
in this. And then he says, can you please turn like that and show me your back? I said, what for? And he said, because I need to put a tube into your spinal cord. My mind blew at that point. I said, what? And I'm like, my gynecologist didn't think to mention this to a first-time mother. And she wasn't even around for the entire labor period. I saw my gynecologist in the last 15 minutes, right before I gave birth. Not until then. And then finally, when they gave the epidural, it was so painful to get that tube to go into the spine. Of course, after that, the pain reduced a lot. And the remaining 14 hours of my labor, so 27 in total, that went easy because of the epidural. But I think the whole process till then was so confusing. And my husband and I, first-time parents, middle of COVID, no idea what the hell is going on. And our mistake was not preparing for childbirth, just trusting that the doctors and the nurses will do right by us, but it is so far from that. And I think this is why this podcast is so important for anybody to listen to, so that they need to understand that this is going to be a very important day in their life, and they actually want to be prepared for it. Okay, so today that's what this conversation is about, Mekha. Like, it felt like such a weight off my chest to be able to share my birth story
I know
with.
that. I was just going to say that because the moment you finished, you took like a sigh of relief. You were like, I finally shared this somewhere, and you just wanted to take it off. And this is what happens with most of the women. Like, one thing, if you go and ask even your grandmother at this time, she would really exactly know, she would vividly remember how her birth was. Don't you think that? Such an important milestone in your life, you want it to be the most memorable thing, not something where you just recall that back and it gives you, just a lot of trauma or
Shudders.
negative feelings.
Yes,
Yeah.
trauma is the word. Like, I think the trauma of being in a state where you felt absolutely helpless instead of empowered while you were giving birth. I think that was a real feeling. Then, and I think that it's I'm on a mission to tell everyone, don't do this to yourself. Do better than I did. Okay, so let's talk about the Lamaze technique, because you're right. The only time that I have truly ever heard about Lamaze is in the show Friends. Remember when Ross says like, "Oh, I've got Lamaze," and Chandler jokes, "Oh, and I've got geography. I'll meet you in." And from then, I've always known that Lamaze has something to do with childbirth. But I think most of us do not know what Lamaze is. So, as a certified Lamaze instructor, can you tell us what is the Lamaze technique to prepare for childbirth?
So when we talk about Lamaze, Lamaze is not any fancy exercise. It's not any kind of breathing. Yes, breathing is a part of Lamaze. It is one of the coping strategies, but it is basically a philosophy which is actually, grounded on six pillars. Lamaze actually revolves around these six healthy birth practices, which we call as the cornerstones of the Lamaze practice. So we will talk in detail about those six healthy birth practices, like just to point it down. Firstly, it says, let labor begin on its own. Okay. Something that, I can again relate back with your birth, because the doctor told you that you needed to be induced at 37 weeks. You just trusted them and you went and got induced. But was your body ready for that induction? Your cervix was still kind of closed. It was not ripened, and your baby was not ready at that time to be coming at that time. On contrary to this, if your body would have given you some signs and symptoms that yes, the labor is approaching, you might have started some contractions before, or if your cervix had started brightening or softening, and then if this induction would have been done, yes, the 27 hours must have reduced down drastically to much lesser. But other than that, you might even not have required an induction, because babies know when to arrive. Your body knows when to birth. Second, walk, move around, and change positions throughout the labor, which women really don't do, because the first image of a laboring woman that anyone gets is, okay, labor has struck, she's in the hospital, she is supposed to be on the bed. And that's what we keep seeing in movies, drama, serials, everywhere. The woman is just on the bed, helpless, just shouting, screaming, and then the doctor comes. Finally, the doctor tells her push, and then yes, the baby is out. Boom, that's it. But that's not how it's supposed to happen. The more you're going to move, the more your uterus is going to contract effectively. You know that uterus is a big chunk of muscle, right?
Yeah.
Now, if this muscle has to move, there has to be enough blood circulation given to that muscle. And for this blood circulation to happen, you have to get up and move. The more you're going to get up and move and you're going to change positions, this baby is also going to descend. And that's something which women fail to understand. They'll be just flat lying on their backs and they refrain to move because they're scared. The doctor does not allow. And second, because they are unaware that they can move, or they think that, they can harm the baby, or that can cause more discomfort to them. The third principle that Lamaze talks is bring your loved one or have someone for continuous support. It could be your mother, it could be your partner, or it could be even your best friend. Because during labor, every woman is different, and she might be able to kind of seek support in someone whom she's finding really confident and comfortable with. Only thing is, you just need that continuous emotional support with you. The fourth principle, and the major one, that, avoid medical interventions unless and until it is necessary. I always tell this to my clients. With medical interventions, you start one, you buy one, you get one free. It's always like that. And it has like a cascade effect. It's like a cascade of interventions that follow. Now, for example, if you've got induced, and you are in the hospital, definitely with induction they will also start you with some kind of IV fluids. And then what happens is, because you are just pinned down in the bed with all these lines, you are just there, you are not walking, moving, and you're just resting there. The progress is not happening very well, and because of the induction, the pain is just going to intensify to another level. And then after a point of time, the woman raises her hands up, and then she'll be like, please give me something to manage this pain. I can't do this anymore. So, the epidural comes in. It's like another one which was given. Now, with the epidural, again, women really don't know when to take the epidural. They just want to ease down that situation. Now, if you take the epidural too early, the progress is going to be much slower. And what happens is that in the hospitals, they run by protocols, they run by policies. They do not, wait for you to kind of take your own sweet time to, okay, she's taken an epidural. We do understand that this is going to get slower. Let's wait for another 6 to 7 hours for her body to kind of adapt to this change and just dilate beautifully. No, no one waits for that. They will wait for a few hours, and then, things are not progressing. It ends up with a C-section.
I get where you're coming from because once I did get the epidural, and because the dilation didn't progress for 10 hours, I was stuck at 4 cm. I was given, like, I was maxed out on oxytocin because that is supposed to help with the dilation. And because of all of these interventions, it got to a point where my baby's fetal heart rate was dangerously high. And I was not only just hooked up with IV fluids, I was hooked up with a heart rate monitor, fetal heart monitor, and I'm literally pinned down on the bed. We are worried about the heart rate of my baby. The idea of the C-section was floated. And while they were consulting with the more senior doctors and everything, and it just happened to be, it was honestly a miracle of God that by the time the doctor came in and they did another exam, suddenly I was at like 7 or 8 cm. It happened within a matter of like 45 minutes, what didn't go on for like 10 hours. But like I know for a fact that if at that point they had come in and I was still at 4 cm, they most likely would have advised me to get a C-section, which I will tell you very honestly, because I had put my entire faith and trust in my doctor, I would have said yes to. Because I would have just thought of the fact that, like, I think they are a doctor, so they must know what they're talking about. And I would have just agreed to it because I didn't think to educate myself enough beforehand. Right? So I get where you're coming from. With the medical intervention, you ask for one, you not one, you get like five free with it.
It's like a domino effect. At the same time, you have to keep in mind that if the mother requires something at that moment, keeping her past history in mind or current medical history in mind, definitely a medical intervention could be, I always say use your judgment. Making informed decisions makes a whole lot of difference rather than just blindly believing or just listening to, kind of what the doctor is providing you at that time. Pregnancy is a state of health. It's not a state of illness or infirmity. When you walk into a hospital just to labor, you are treated as a patient. With all these wires and lines and, all the restrictions that they have put around you, you look more like a patient than a healthy mother who has come to birth her baby. Right? So you need to have that awareness within you that you are absolutely fine, you're absolutely healthy. And it's only when, there are some red flags or red signals that my body or, keeping the safety of the baby is kind of being compromised somewhere is when I would require any medical interventions. Or else I'm absolutely fine.
Beautiful. Beautiful.
So this is the fourth Lamaze pillar.
Yeah.
The fifth one actually talks about avoid giving birth on your back. Follow your body's urge to push. I
What?
see a eye roll there. You'll be like, how? How do you say that? Because everyone gives birth on their back, right? That's what we've seen since ages, okay? But if you actually look at history, look at research, look at evidence, and if you actually see these, there are beautiful pictures from the history of these goddesses and, giving birth. You will never see them lying down. You will see them like standing with strong people, with their midwives or other women from the community, and they are in upright positions giving birth. And this was something which was happening since ages. Women have been using probably ropes, supported squats or squat bar or anything to get better leverage and then been pushing. Because what happens is the moment you are on your back, first thing, it's compromising the blood supply to the baby. Ironical, right? All throughout the pregnancy, they tell you not to lie on your back because that's the most uncomfortable position to be, and that's going to compromise the blood supply to the baby. Okay. And suddenly in labor, they're putting you in that uncomfortable position throughout.
But like if you look at the labor and delivery room, they have that like half reclined chairs. They even have those holder thingies to put your legs in. So
Correct.
I cannot imagine birthing in any other position than this, because that's literally how the equipment is set up. Why
Correct.
why is it like that?
Let me ask you. When I said about upright position, what do you think? Why are we saying that, women should be using upright position? What is kind of helping you? It's the gravity.
Yeah,
When you're going to lie down on your back, you are going to be against the gravity,
true. The baby has to come out like
right?
this instead of
Yes,
like
it's
this.
it's much easier for the baby to kind of slip down through a tunnel than crawl through a tunnel. You have
Right.
to be in a position that is gravity neutral. Upright positions are the best positions, those are gravity neutral. And this is exactly, see, we are telling the second Lamaze practice walk, move, change positions. If you're doing that constantly during labor and right when your cervix is fully dilated, definitely you will be able to kind of push in a much better way because the baby is just there at the rim of the cervix. And then all that you have to do is just listen to your body's urge and then push.
So, Meka, tell me, why is it that doctors and nurses are not telling us about this when we are in the labor room?
Correct. So it's not that they are not telling you about this very intentionally. There are two things that's actually happening here. Over the years, what has happened is doctors have kind of developed their own routine and practice in handling labors and births. Probably one doctor would be feeling that lying down on the back works the best because that's where I can kind of visualize everything and I come and tell her just push or I can just do whatever at that time and help come help the baby to get out and that saves my time and her time and everything is done. Second, every hospital, just because most of the births take place in a hospital these days and hospitals, as you know, view us as patients. Okay. Now, when you are actually going and utilizing a hospital or hospital bed, you are actually also utilizing all the resources around it. And we know that labor is something which we cannot predict. Labor can go up for hours. And to provide that manpower for you continuously at that point of time, probably for 27 hours straight, it becomes very difficult for the hospital. For them, within 4 hours or 6 hours, something is not done. That's what can actually help the patient get into the next stage and, kind of probably even expedite the discharge better or earlier, right? So, two things is individual preferences and practices by the doctor, and second, the hospital policies and protocols, which are the two main villains. Women are not able to kind of voice out what they want, or they are not allowed to kind of just wait and watch the progress of labor.
Yeah. I mean, advocating for yourself takes a lot of strength, and you need to be well educated, because how else are you going to have the confidence of saying that, like, I don't want to do what the doctor is asking me to do, I want to do what my body is telling me to do? That is a lot of confidence. So, Meka, let's keep going. We have one more like cornerstone left. of Lamaze?
The last pillar is keeping the mother and baby together, and that is like nesting the mother and baby together, and which is not only just good for the mother, the baby, but also good for breastfeeding,
Mm-hmm.
which often is negated. What happens is immediately the baby comes, baby is the star, baby is the main hero at that time, baby cries. The mother is just shown the baby just like this. There's your baby, the baby is crying, and the mother just sees. But what you're not understanding is when the baby is just taken out, and the first cry that the baby is taking is actually because of a lot of discomfort that the baby has also gone through. Labor is hard work, just not just for the mother, it's also for the hard work for the baby. The baby also has taken equal efforts to navigate his or her way down there and then finally come earthside. And the two active reflexes that any baby has when the baby is born is first the sense of smelling,
Mm-hmm.
and second, the sense of hearing. When the baby, you will actually notice when the baby is taken out and immediately placed on the mother's chest, you will notice that the babies go silent. They are just consoled on their own. And why is that happening? It's hearing the same heartbeats that it was hearing inside the womb the moment it is just kept on the chest. And the baby is reassured, the baby is comforted that, yes, I am back to the place where I was taken from. Everything is safe around me. That's the first sense that they have. Second is the sense of smell, because they have a good sense of smell, and because when the mother is so elated at that time, the whole oxytocin supply is coming from this baby at that time, there is the release of prolactin, and the baby starts smelling this and latches beautifully at that time on the breast, and then that is the onset of breastfeeding. And if you don't use that golden hour to your own benefit at that time, the whole issues of latch trouble, breastfeeding, and all of that creeps in later on. And that golden hour is so important. What happens is the baby is taken away, the mother is just so tired and everything, she just dozes off. She's later on the placenta comes out, the stitches are done, medications are given, she passes out for a good 1 or 2 hours. They nicely give some top feeds and formula feed at that time, baby is comforted. Baby has not learned how to latch at that time. And then
Mm-hmm.
you get the baby back to the mother after 1 or 2 hours and then like feed. Because baby has already learned an easy method right now to just, take in the top feed which was given. The baby,
Yeah.
it takes a lot of effort for the baby to start sucking and get that right latch. And then the mother starts questioning herself. Oh my God, no, I think I'm not doing enough. My breasts are not producing enough, or my baby is hungry and that's why the baby is crying constantly. But what you fail to understand is you did not use the golden hour to your benefit.
Such an important thing, because once you have done the birthing and you have the baby, right, a lot of parents don't know how to navigate that either, because if for most first time parents especially, they have never really seen or held a newborn, so you're trusting the nurses and doctors with it, because people don't understand what exactly is the value of skin to skin early initiation of breastfeeding. They cannot envision that a newborn baby who has just come out can actually crawl their way onto the breast on their own, because we have not been given that information. And I'll tell you, in my own birthing process, my baby was immediately, the cord was cut, she was taken on that little bassinet, they wrapped her up, put a hat on her, and then they gave her to me, and I
A
was
lot
allowed to
of time
hold
was
my.
already lost.
Yes, so the time was lost, like, and on top of that, what we did, I held her, it was not true skin to skin. It was, I was still wearing my maternity gown, and she was literally wrapped up in a swaddle with a hat. So there was no skin to skin. And you are right, it was after I held her, and then, of course, we were allowed to see some pictures. Then the nurse kind of comes in, they're like, okay, let's try to latch. And, firstly, it's a little bit awkward because there are like two other people in the room and it's a little uncomfortable. But I said, okay, sure, let's try it. But I guess maybe because she was so like swaddled up, she couldn't. And then, of course, I was tired. She was taken away, given formula in the nursery. I don't have anything against formula feeding. I think that's something that I am a very pro fed is best thing. But I do believe that the breast needs to be given a fair chance.
As you said, you are studying to be an LC. You really understand like the breast crawl. It's a beautiful thing to watch actually. You at the first time that I actually saw a breast crawl, I was blown. I was like, how is this happening that a little one who's not even taught anything is just crawling up to the, breast and just, going and sucking without even being guided, without even being taught once. It just smells the, smell of prolactin from the breast and then just kind of goes and latches there. And it's beautiful to
Must
watch
be
that. And
magical for the mom to experience that.
yes,
Like,
yes. But
wow.
how many mothers are given a chance at breast crawl? Like,
I'm
barely. You go and ask that in a private hospital here, they'll be like, are you crazy? We don't have the time to do all
Yeah.
of that. At that time, we can go clean the baby, do everything.
I've studied that the breast call can take up to an hour. Just being with your baby without anybody coming to clean up the baby and swaddle the baby and this the baby and that. No, everything can wait. This needs to happen first. And what about C-section mothers, Mekha? Is a breast crawl and skin to skin, all of these are these possibilities even for a mom who has a C-section?
Absolutely. And see, there was a different mode of, for this baby to enter this world. It still does not deprive the baby for and the mother for respectful maternity care. Still, the mother can be heard. Still, the baby needs to be given all that, it could have been given if it would have chosen to come through a vagina. Just because it chose the abdomen, its route of entry into the world is not that the baby has to be taken somewhere and the baby is at high risk and all of that. There's something that we call as gentle birthing, that is a gentle C-section, where still a mother is heard and respected for her choices. So the baby is taken to the mother and can be very well placed on the chest. Why not? I mean, it's just that the baby did not come through a normal vaginal entry. It's just the baby has come much more, in a sterile way. Baby can be kept on the mother's chest. There's absolutely no problem. And it's nowhere hindering the operation at that time. They're taking out and keeping the baby back on the chest and allowing that moment for the mother and baby to enjoy that golden hour. And a delayed cord clamping is something which can be done at that time. These are all something which comes under gentle section or a gentle birthing approach. And this is something women need to start discussing early on. All the what ifs, because we really can't predict what is going to happen. Understanding and making sure that even your care provider is on the same page with you. One more thing that happens with C-section is that the early initiation of breastfeeding is delayed. Now, hormones are kind of into play over here as well, because when we talk about a normal vaginal birth, there's this rush of oxytocin that is happening and everything. But somewhere when it is a scheduled C-section, probably her body was not ready. The labor was not supposed to begin at that time. You are forcefully going and, getting this out. So there is no natural oxytocin that is kind of produced. The whole orchestra of hormones which is being interrupted at that time. So that can again cause, a delay in breastfeeding. And most of the C-section mothers often complain that, I was not able to feed in the initial days. But what you don't understand is when the baby is out, immediately the oxytocin is being supplied via the baby. You still have a chance, but just that you don't understand it, and the mother and baby are not, given the chance or opportunity to latch early on. They just take the baby away, they just take the mother away. The mother is sedated after that. The mother wakes up after a good 2 to 3 hours. Baby is given feeds, and then they start, and then the general perception starts okay. C section mothers, only after 2 to 3 days, the milk will come in. But
I
it's
understand.
one thing that people don't understand is milk comes in when there's a demand. Only if the baby is going to come and suck and latch, that's when the body will understand there has to be a supply.
I get it.
The
I
more
get it.
the more the baby is going to come and suck on the breast, the supply will be there. These are some things that you can start educating yourself early
Mhm.
on so that you don't go into the whole cycle of trauma and depression later on, that thinking, oh, I have failed myself.
All right, Mika, I mean, like I said earlier, you are blowing my mind because there is so much that I feel we as parents need and deserve to know, but we have not been given that education. So if, let's say, childbirth education, you feel like I feel that childbirth education should be a rite of passage for every family who's pregnant, especially with their first baby. This is not something that we should just leave it to the people around us to manage and command. We need to take the reins in our hands. So, Megha, if anybody wants to get in touch with you and work with you and learn from you in terms of how to be best prepared for their birth, what's the best way to do that?
You can just drop me a hi. I'll just put my Instagram handle, that is Inizio Birth. So you can drop me, you can connect over there, and then I can tell you about the sessions that I take, or probably answer your queries and then work together. So that's the way that we work about.
Amazing, amazing. And if you could leave our listeners with one last nugget in terms of what's the one big advice that you would give somebody who's expecting to have an empowered childbirth?
I would say take charge of your birth, okay? Just like how you took charge of everything else, your body knows exactly how to birth, but you also need to trust and believe in your body. And most importantly, trust your intuition. What is your inner voice telling you to do? So listen to your own voice, listen to your intuition, and trust your body. We were meant to give birth, and we exactly know how to birth our babies. So start believing in yourself.
I love that message. Thank you so, so much for joining us today, Mekha. This was one of the most enlightening conversations I have had on this podcast. And I can't wait to welcome you another time to keep this conversation going. And to everybody who is listening, if you like this episode, do give it a thumbs up, subscribe to our channel, and follow us on Spotify or Apple Podcasts if that's where you're connecting with us.
Thank you.